For the past decade, UF Health Proton Therapy has treated more than 6,400 patients. Charlene spoke with one of the doctors who is helping to save lives. Take a look.
Well, as we know by now, proton therapy is used to treat many types of cancers. And here to talk about a few of them more is Dr. Michael Rutenberg. Thank you so much for being here today.
Thanks for having me.
Now, your area of expertise is treating cancers that occur in the gastrointestinal or digestive system. So to me, that's like basically between here and here. So can you walk us through a little bit about what organs that we're talking about in this area?
Sure. I think you just about nailed it.
Okay.
Except it's really from here to here. So we often think of the GI system as the stomach and guts or intestines, but there's also several other important organs that are particularly important for oncologists who treat cancers because cancers can arise from those organs. So we started up at the top with the esophagus, and food travels from the esophagus into the stomach. There are also other sort of peripheral digestive organs, the liver and the pancreas, which are critically important to nutrition and metabolism. And so further down from those, we go to sort of the more well-known GI organs, the small intestine and then the large intestine.
So kind of anything involved in digesting, whether when it's coming in or going out.
Exactly.
Easy to remember.
From top to bottom, yes.
And so let's talk a little bit about, I mean, you have such a variety of different areas and organs. How do you detect cancer in these particular organs? And I would think maybe the detection is different in some of these cases.
Sure, you're absolutely right. And so perhaps one of the best known detection systems is colonoscopies. And fortunately, we have a good tool to detect early colon cancers. Unfortunately, for the rest of the GI system, we don't have good screening tests. And so patients will often present after they've developed symptoms, or perhaps on occasion when they've had abnormal lab testing for one reason or another. Really, it depends on what organ the cancer arises in, is how patients will present. So for example, esophageal cancers higher up, patients will typically present with difficulty or painful swallowing or worsening reflux symptoms. Further down, liver cancers will often present with jaundice or sometimes abnormal laboratory studies for one reason or another. Pancreatic cancers, similarly, they don't have very typical signs, so it's usually jaundice is what a patient presents with. But otherwise, it may be asymptomatic for a long time.
What I'm hearing is pay attention to everything. If something looks or feels or sounds a little off. So let's talk about proton therapy. You do such great work here, but treating these types of cancers in these organs is fairly new to proton therapy.
Sure. Really, in the last 6 or 8 years, protons have become more widely used for gastrointestinal malignancies. And while protons have been around for decades, some of the technologies are just now reaching a point where we can do some really, really amazing things with them. And so it's only in the recent decade that GI cancers have been more widely treated using protons.
And I think folks always want to know is it help, kind of deter some of the side effects of it, and then what's the success rate? I think those are the two things everybody wants to know in terms of this type of treatment.
Absolutely. Those are the questions that people need to be worried about. And so in terms of how protons have been doing, again, the results so far have been very good. Very encouraging. The results with protons compared to traditional radiation treatments are as good. The real goal with protons ultimately is to improve the chance of curing patients while minimizing some of the toxicity caused by traditional radiation. And so it's a little too early to know how much better we are doing with protons than with traditional treatments. Certainly all the data we have are promising at this point. But we'll know a little more as we generate more and more data over the next years and decades. And
that data comes from the critical studies and work that you all and research that you do here. Can you talk a little bit about maybe some of the clinical trials that you have going on? Because it's we're so blessed to live in the backyard of such a wonderful medical facility and have the opportunity to participate in these.
Yeah, so in terms of our GI group, there are several interesting studies that are either currently open or are in the works. We have a really exciting pancreas protocol that's open, so a pancreas trial, where we're working on intensifying treatment for advanced pancreatic cancers with the hope of improving outcomes, improving disease control outcomes, while minimizing the side effects.
That one's so important to catch soon, because like you said, you don't see it till you really start seeing symptoms.
You're absolutely right. And so unfortunately for a lot of pancreatic cancer patients, because they don't know until symptoms, until it's later on in the disease process, locally advanced pancreatic cancer is a common problem. and we're working on finding ways to better treat it while at the same time reducing side effects. Another study that we have opening soon is an esophageal cancer study, and we're looking at improving the outcomes or the cure rates of esophageal cancer while reducing the risk of injuring nearby heart and lungs, because for esophageal cancer, the esophagus is positioned right in between the heart, the lungs, and the spine. So it's a really challenging disease to treat. And with protons, we can better spare or avoid radiating the normal heart and lungs that surround the esophagus and the cancer. And so with this study, we're looking at improving the chance of curing these patients while reducing the risk of injuring their normal lung tissue.
Well, Dr. Rutenberg, thank you so much for joining us today and giving us all this really important information. And of course, we'd always like to thank UF Health Proton Therapy Institute for inviting us in and for sponsoring this segment and providing all this great life-saving information. And for more information, you can go ahead and visit their website at floridaproton.org or give them a call at 904-588-1436.